Hi, this is Dr Manas Chakrabarti. I'm a gynecological oncologist and I make patient education videos on complex gynecological topics. Today's video is very interesting. It's about the chocolate cyst, if it can hide cancer. Let's watch. In the first part of our video, we have discussed in detail that how the chocolate cyst is a manifestation of a condition called endometriosis. And we have discussed about endometriosis there as well. Now, when there are endometriosis, there are some risks of cancer. It's not a lot. Endometriosis itself is a benign and non-cancer condition, but endometriosis can give rise to cancer in certain cases. When we went to medical colleges and we learned from textbooks, at that time they said if someone has got endometriosis, then she almost couldn't have cancer of the ovary. But we know that that is quite a wrong assumption, and with more and more researches, things are gradually coming out that yes, there are slightly increased chances of cancer in the cases of endometriosis. How much is the risk? We are not going to discuss the very scientific numbers and details because it is going to only confuse you. It is there, small amount. And basically here comes a very important and crucial question of our discussion, that we treat endometriosis based on ultrasound scan reports. But are the ultrasound scan reports 100% reliable? Let's find the answer. The short answer of this long discussion is basically ultrasound reports are not 100% reliable. That is same for most things in medical science. In medical science, whether you have got ultrasound or whether you have got a CT scan, MRI scan, or sometimes is a big behemoth of scan is known as PET-CT scan, nothing is almost 100% accurate. It's neither the ultrasound scan. But ultrasound scan is commonly used to diagnose endometriotic cyst or chocolate cyst and to decide which way the treatment will follow. That whether it's a medical treatment or surgical treatment, or is the conservative, that is neither medical non-surgical treatment. But this ultrasound scan report itself is not 100% accurate, and even if it is done by a very majorly renowned ultrasonographer or big specialists, it can never reach 100% accuracy. That is very. And when I say this, that it is not 100% accurate, it is a direct result of various researches and various studies, and it's just not an assumption. Even if the ultrasonographer is very efficient and does the ultrasound very minutely following IOTA, that is International Ovarian Tumor Association protocols with the ultrasound, which actually decides the ultrasound report based on more than a dozen of various factors, what the ultrasonographer see during your scan. Even then, it is never 100%. It can miss a sizable number of cancer. It can miss a sizable number of other adjacent problems from this. No, it should not make you alarmed, but it should make you aware. You need to be aware about your own body because this is, after all, your own cyst or your friend's cyst or something like that. So you need to understand the basics of medical science. The way the ultrasound scan diagnoses a problem is a bit complex. There is no one standing with a flag that I am endometriotic cyst or I am chocolate cyst or I am this cyst or I am that cyst or something like that. The ultrasonography relies, as I said, based on very important subtle impressions, that what is the wall of the cyst, if it is irregular, it is thin or thick, or what is the consistency of the fluid within it, if there are compartments within the cyst, if there are solid areas within the cyst, and these are many other things. And talking about solid areas, we must understand as well that solid area is a red flag signs in ovarian cysts. Another important parameter, which is known as Doppler ultrasound scan, which tells what is the blood flow within the ovary. Every living tissue will have some blood flow, but if the blood flow is too much, that indicates sometimes that there are some problems. There must be something happening within the ovary or within the cyst or within the chocolate cyst, which is attracting a lot more blood supply. Body attracts a lot more blood supplies in various cases. If particularly there are chances of big cell divisions, massive cell divisions going on, that attracts a lot of blood supply. And whenever there are abnormal massive cell divisions, we have to think about cancer or precancer or similar conditions. Not all increased blood flow will denote cancer diagnosis, but this is something one should understand. The main crux of this complex discussion, if you have managed to listen to all this, is basically that ultrasound report is not 100% accurate. We can sometimes, if we have got a suspicion whether it is a malignancy or not, we sometimes escalate the ultrasound scan by another scan, which is known as magnetic resonance imaging. Even then, it is not 100%, but is much more decisive than ultrasound scan. But because MRI scan is costly, the primary scan is always ultrasound scan, because no one wants to spend so much on MRI scan. And MRI scan, of course, if it doesn't give you any extra radiation or anything like that, unlike the CT scan. But MRI scan is cumbersome to do, and it takes a long time to do and everything. So it cannot be done as frequently as ultrasound scan is. It's not as patient friendly, that both from pocket and from physical aspect. Sometimes patients come to tell us that, doctor, I have got this chocolate cyst and I have got a cancer marker CA125 elevated. Does that mean that I have got cancer? CA125 is a chemical marker in the body. It can be raised in malaria, it can be raised in typhoid, it can be raised in cancer, of course. And because it is sometimes used to check the spread of the cancer and everything, therefore, whenever there is high level of CA125, the patients get a red alarm. Whenever they search Google, they find out CA125 ovarian cancer, they come running. Not all the cases of CA125 will mean that the patient has got ovarian cancer. Fundamentally, CA125 is a measurement of intra-abdominal irritation, whether it's from the cancer or whether it's from the chocolate cyst. The CA125 can sometimes remain elevated in endometriosis and in chocolate cyst. It doesn't always mean that it will definitely be a cancer, but if it is elevated, you must consult your gynecologist or gynecological oncologist if you have got access to those type of doctors to understand what is going on. If CA125 is higher, we need to check what is going on within the cyst, if it has got a compartment, or basically whether it's a simple cyst or whether it's a complex cyst. If you do not know what's the difference between simple cyst or complex cyst, you need to follow this discussion, follow this channel, and one day we will discuss regarding this. If the CA125 remains elevated in a complex cyst, then of course there are higher risks of cancer. That does not mean that one has definitely got cancer, but higher risk of cancer. Purely for this diagnostic complexity, American College of Obstetricians and Gynecologists, ACOG, has recommended that if the CA125 marker is very high, or if they have got suspicious problems within the chocolate cyst, then they sometimes get referred to gynecological oncologists to understand the basic problems over there. And even if they need a surgery eventually, the surgery is done following very stringent rules and regulations so that their disease get addressed very well in the first instance. So that's all today. I hope it answered your question regarding the relation of the chocolate cyst and the cancer. We'll see you soon.